Welcome and thanks for joining. My guests today are Carolyn, otherwise known as Bo Aldige, the CEO of Prevent Cancer Foundation, and Dr. Jim Mulshine, who is a professor at Rush University and also the vice chair of the board at Prevent Cancer Foundation. Welcome, guys.
Thank you.
Glad to be here. Thank
Great.
you for having us.
Well, today we're talking about investing in your health because just as you can set aside money in a Roth IRA or 401k to better your financial future, there are some things you can do to better your future physical health as well. Everyday choices we make in our 20s, 30s, 40s, and beyond can really impact our well-being now and down the road and may even help us to prevent cancer. So first, let's talk about prevention when it comes to cancer, because I think a lot of times we hear about prevention in relation to obesity, diabetes, other sorts of chronic diseases. So how is cancer preventable?
Well, cancer is another preventable chronic disease, and it's preventable with a lot of lifestyle choices that we already know enough about to be able to reduce about 50% of cancer right now with just what we know. So we know that, I think everybody knows, you should never use tobacco in any form. But maintaining a healthy weight, eating a healthy, balanced diet, being physically active, protecting your skin from the sun, getting recommended immunizations against certain viruses that can cause cancer, getting recommended screenings, and knowing your family history can all help you prevent cancer. And these are things we can do right now. And most of these risk factors are the same when you think about it. The same risk factors for heart disease, for diabetes, for cancer.
Great. I guess when I think of cancer, I kind of drill down to the definition of rapid division of these mutated cells. So how can those things that you mentioned stop these cells from rapidly dividing?
They don't have the mutations in the first place.
Okay.
So once they mutate, then yes, they are on a pathway to rapidly dividing, but they don't necessarily have to start mutating.
Okay.
Yeah, and my training's in cancer medicine, and we've been thinking about this, working in laboratories for years on these things. And it turns out our lifestyle drives a lot of inflammation, chronic inflammation, whether it's diet leading to overweight, or it's lack of exercise. Mm-hmm. Inflammation occurs in the body. Over time, it builds up. It can interact with other things, exposures such as tobacco, where there's cellular injury, DNA injury. But the chronic inflammation creates a promotional environment where the cancer can nurture. It's a nurturing environment for the cancer where it can grow and evolve and become intractable, non-curable. The great thing about prevention is that you're engaging in things that prevent the early stages of cancer, when it's localized, when it does not require dramatic interventions. It's things like, skin cancer care is very, very, generally speaking, mild. And people get better, and they can go back to what they're doing without any kind of restrictions. So it's really a wonderful time because we have so many things that we can do proactively to reduce our risks of these cancers. And these things are not bad things. They're not onerous things. These are things we can simply build in, and they have spillover into your health in other kinds of beneficial ways. So it's a great time for this.
Great. And I know at Prevent Cancer Foundation, you guys lay out 7 steps that people can take to reduce their risk of cancer. And Bo, I know you mentioned a few earlier.
There
you go. You went through all of them.
I took them off.
Wonderful.
I can go over them again just to reinforce.
Are there any that maybe people don't think of that aren't top of mind that are very important to highlight?
I'm not sure people think of vaccinations that prevent cancer. And I know we're going to talk about that at some point. So, but that's a really important area that we need to focus on. Mm-hmm. I'm not sure that people realize that having a healthy weight is that important to cancer, but it's predicted now that obesity will be responsible for more cancer by 2030 than even tobacco.
Oh.
So healthy weight is key. And you get that with energy balance, which is calories in and calories out, physical activity, and a balanced diet.
Great.
And it kind of comes together because We have an aging population, and many of the cancers that people are familiar with, the numbers increase as you get older. And yet, if you can maintain a healthy lifestyle, and we've already talked about that that's good in terms of cardiovascular health and other things, it also helps you with cancer prevention, because if you're keeping a healthy lifestyle, you're staying active, you're avoiding tobacco, chances are your weight will stay closer to where it was when you were 25 and 30 and stuff like that, and that's a very good thing. And that helps you with your bones and your joints and lots of other things as well. So thinking about the later years in life and doing the kinds of Roth IRA savings equivalent in terms of your health plays profound benefits, and it really helps you be more engaged in what you want to do.
Great.
I think it's really important to point out that health is holistic. So just as I said a minute ago, what you do to prevent cancer can also help prevent diabetes, can help prevent cardiovascular disease. So rather than just carving out one disease, we focus on cancer prevention, and we have for 33 years since we were started. And ironically, we're the only organization that we know of in the country that focuses strictly on cancer prevention and early detection and how you save lives through those two means.
Wonderful. You kind of touched on my next question, which is, at what age should we be concerned about this? I mean, is there an age range when one is more at risk for cancer?
I think that, as you get older, your risks for lots of cancers increase. But I think the kind of lifestyle that allows you to be physically fit and active, vigorous during the day is something that starts in childhood. And so that's why, recess and things like this are so important. And it's so important for kids to get exposed to a variety of sports. They don't necessarily have to be a NBA all-star, but if they have a lot of different sports that they're comfortable with and they can stay engaged in, it's great, because for adolescent girls, being active in vigorous sports lays down greater degree of calcium in their bone structures, and it helps them be stronger when they're 50, 60, 70, 80. And if you're doing things like a vigorous physical activity and you're maintaining your weight, your chances of colon cancer, breast cancer, are very significantly modified. And, you're not losing anything, really. You're much better off without those things.
Wonderful. So it really does start young.
Absolutely. I would say you're never too young.
I'm your moderator, Rachel Nania, on Invest in Your Health, sponsored by the Prevent Cancer Foundation on WTOP.com.